Goonies or Stripes?
I'll go Goonies.
Go Stripes. Doug probably doesn't know what Stripes is.
I was going to say, I didn't want to say that.
Refer to memes in your Slack channel. I will just say that. Okay.
Try to fix the current system or reimagine something new? Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the change is permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show. This is a mission, y'all. As healthcare leaders, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. We have our first shout out, a new segment recognizing some of our listeners and thanking you for tuning in. Then I have a candid conversation with Praia Health CEO Justin Dearborn and VP of Strategy and Operations Doug Grapski on the greatest opportunities for health systems to lead out in orchestrating consumer experiences. I'm Jared Johnson. Let's get it. A local sports radio station that I listen to frequently recently started implementing shout outs to local cities in the area and thanking listeners in those cities for tuning in. They're short ways to thank segments of their audience, and I thought I'd try the same, especially given the various groups of listeners that we have now. So we'll try these periodically, starting with longevity, wearables, and preventive health companies. This shout out goes to the longevity builders, the wearable product teams, the diagnostics innovators, and the preventive health founders who wake up every day thinking 5, 10, or 20 years ahead. You're chasing features, funding rounds, and more importantly, outcomes. You're asking hard questions about how people actually live, age, move, sleep, and manage their health long before they ever show up at a clinic. We're especially glad you're listening because you're operating in the hardest part of the market, the space where behavior change meets science and adoption is earned. You're translating biomarkers into motivation, data into daily habits, and insights into something a real human can actually act on. For the founders with vision and grit, the ones building without a perfect reimbursement story, the ones testing, iterating, and explaining the same value prop for the 100th time, we see you. And for those focused on growing adoption, not just downloads or devices shipped, you're asking the right questions. Healthcare Wrap exists for people like you, builders who believe the future of health is proactive, personal, and deeply human. So we wanted to thank you for tuning in and pushing the system upstream. Hey, I'm here with my friend Carol Flagg from Healthcare Now Radio. Carol, you and I have an exciting new partnership that we want to tell people about.
Yep, we'll actually be launching an exclusive new opportunity called Limited Series. And these series will air nationally on Healthcare Now Radio, which, by the way, was named once again as one of the top 10 healthcare shows again in 2025, as well as here on the Healthcare Now Wrap. These series are going to cover some of the biggest topics in 2026, starting with rural health and including the CMS health tech ecosystem, GLP-1s, wearables, and more. So we're really excited about these series because there's a lot to talk about with these topics, which means they are ideal opportunities to create thought leaders in these spaces.
Yeah, Carol, that's what I'm the most excited about, is to really generate more informed, trusted information on these topics. And for those who are interested, spots are extremely limited for Q2 through Q4 of 2026. To get started, just reach out to either of us on LinkedIn, and we look forward to hearing from you. Hey y'all, I'm here with Israel Krush, founder of Hyro. Israel, what's an easy to understand example of how an AI agent can help consumers in their health journeys?
A simple section would be the fact that instead of enrolling into Medicaid and proving that you're eligible once a year, you need to do it once every 6 months. Patients don't know that. So we said, you know what, we're going to get ahead of that and we're going to educate patients about some of those changes and try to get them re-enrolled or redetermine their enrollment into those programs to make sure that one, they're covered, and two, that the health system gets paid or reimbursed for those patients. So I think that's like a clear win-win where you create an AI agent that is proactively helping both patients and health systems with issues that they face and make, again, the journey a little less complicated.
Thanks, Israel. Visit hyro.ai for more information. That's HYRO.ai. And tell them you heard about it on Healthcare Wrap.
flow.
All right, let's get to the flow. I'm here with the guys from Praia Health, Justin Dearborn, Doug Grapski. Welcome aboard, Healthcare App. We're ready to dive into a few things here, but glad to have you both on the show.
Thank you, Jared. Congrats on all the success of the show. You've had some real A-listers this year, continuing your hot streak. Hopefully we can compare, and at least I brought Doug to carry the Praia water so we can continue the great line of guests you've had.
Yeah, so excited to be here.
I think we'll be able to keep things up at that high standard. Always good to start with giving our audience a little chance to get to know you a little bit better. So maybe, Justin, we can have you go first in terms of who you are, what you do, what you'd like our listeners to know. Then we want to dive into a few things that are going on at Praia lately and just kind of what you both are seeing in the industry. So yeah, let's start there.
Sounds good. Well, we are still a somewhat unique on the early stage company side. And what that means is we spun out of the Providence Health System last year with a production or really commercial quality solution, and it's been live and producing results at Providence for 3 years, but just really entered the go-to-market or the commercial side post-spin out kind of about a year and a few months ago. So just kind of hitting stride within the health system market right now. And Doug's going to just give you a real quick overview of the problem Praia was designed to solve and where we're at now in our evolution.
Yeah, Doug Grapski came over from the Providence team, spent about 5 years there working on the digital innovation group where we got to lead Praia all the way from an ideation stage, what problem are we trying to solve, all the way through let's scale it internally, and then into and eventually into the let's bring it to the external market, raise capital, create a company, and get to bring this to other health systems. So really awesome journey to see this all the way through. And what Praia's really focused on is patient experience orchestration. So I think we've seen orchestration actually as a word that's popped up from a lot of different health tech vendors over the past couple of months. It's really picking up recently. And what we're really focused on is how do we connect all those different point solutions, services, programs that patients interact with at a health system that they struggle to find, struggle to enroll in, may not know that it's available to them. What Praia is actually doing is bringing together all those different assets for things that patients are eligible for, making it relevant and personalized to those patients, bringing them together, serving them up, and then doing that all through a single set of credentials and a single way to access that. It could be through mobile channels, web channels, SMS, email, you name it. We can consolidate and coordinate all of that. And then, of course, do all of that combined with the patient portals as well. Nobody wants to have a separate MyChart patient portal app and a health system app, right? You want to bring all the best of those two worlds together. And that's really the sweet spot of what Praia is able to do in the market for health systems is combine those experiences and make it more relevant and personalized for patients.
All right, Doug, I'm going to challenge you now then. Explain this concept to a third grader, like the concept of orchestration. Because again, clearly it makes sense to me. I get it. But we're talking about consumer experience. So we should be able to explain it to clearly the end user. How do you simplify it a little bit?
This is good. I've got good training. I've daughter in TK at the moment, so I can really good at explaining stuff to her. So the way I'll think of it is, how do you make it as simple as possible that when you go looking for something, you find it? And if you want that thing, you can actually just tap it, click to enroll, click to participate, and you don't have to sign up again. You don't have to create more account credentials. You don't have to take any extra action or steps to enroll in that type of program. So what we're doing is bringing all of that together, sucking out all of that friction, and then letting the patients actually engage with it without having to go hunting or look for that pamphlet for remote monitoring that they may or may not have left in their car after their appointment, things of that nature. So we're taking away all of those, that frustration and friction for patients and making it easier for them to find and engage with those tools. And by doing it all in one place, pairing it with that patient portal, you have that pre-built-in user audience. So it's something that patients are familiar with. It's the same set of account credentials. And that lets them, by bringing that all together in one place, you get better engagement and conversion into those. So the healthcare as an industry has really had a hard time with engagement means something, a lot of different things to different people. But what's really struggled is people don't come back, and you lose that loyalty and you lose that retention. And what we're able to do is actually meaningfully see that retention rate. We know when a patient's at risk for churning. We'll know when a patient is at risk for not engaging back with the health system, and we can prompt and intelligently nudge them back into those interactions. So I probably went a little above a third grader, but at least started there.
That was pretty good. Let's roll through a few news items. Praia has had a few announcements recently. I'm sure some of these kind of overlap or are related, but maybe we can talk about a couple of recent case studies that have been published. Just a more recent announcement with LabCorp. I see an updated case study that shares some of those numbers, Justin, that you referred to with Providence about this platform in action, and the launch of Praia Intelligence.
So really a case study, this is something we've been building in partnership with the Providence team, both internally when core members of our team, of our leadership team, were inside of Providence, but now externally as well as a customer relationship. This is a case study that we've been tracking, building on, and measuring. Okay, if we have we're now able to measure how many patients are coming in through the health system, through their digital properties, seeing how they come in from an acquisition perspective. Was it through a marketing campaign? Were they a patient that was acquired through a traditional SEO, SEM campaign? They create an account, they affiliate themselves with the health system, they're creating a Providence account. So it's really important to Providence to have that single account, and that brand relationship is tied to them. It's not tied back to a technology partner. And then what we're able to do is get them enrolled and assigned to a primary care physician who becomes their champion of care and helps navigate them right around the health system into all the different services. So we're able to track over the years, now 3 years at this point, patients as they come through that full acquisition through loyalty funnel. And then each year we've seen incremental growth in terms of the investment that Providence is getting. We've had more patients come in, they start to engage with more and more services. And then as we bring in more partners into the platform, there's more services available for patients to interact with as well. So we're really compounding the value that we're able to create. So I think the first year of full operations was around a $20 million ROI. The second year was like $29 million. And then the third year was upwards of like high 30s. So it's really starting to compound as we bring in more patients, more users into the platform. And then also fill out the other side of the platform equation was all the different services that patients can interact with.
Doug has been leading the charge there for us with LabCorp as well as all the Providence great ROI numbers. It's a lot of work to gather that, but it's absolutely necessary in today's environment to have a strong ROI. So Doug leads that with the help of the Providence team. So he articulates it the best.
What we can point out is just like, those are real numbers. I don't want that to get lost in the shuffle. Like, those are like, every dollar is counted to get to those numbers.
The other color I'll add. So if you look at how we work closely with a lot of marketing leaders as well, but traditional marketing campaign, you'll bring patients in, help acquire them into the health system, into a specific service. And then for acquiring those patients, we'll look at kind of a long tail on how that patient interacts with the health system. That's all the value that traditional marketing campaigns will attribute. We got put through a pretty rigorous kind of pressure test with the finance team at Providence of, you guys can only focus on what is directly booked through your platform. And if it could be booked through any other channel or any other means, and I'll even say the patient portal, for example, we carved all of that revenue out, all of those operational efficiencies out, all of that call savings, all of those costs that we're able to suck out. If a different technology or offering in the health system was able to offer that to meet that patient need, we carved it out and we just focused on what Praia was able to drive. So what's left out of that equation, right, is if we acquire a new patient, we bring them in and they have a virtual visit or a primary care visit, meet with a specialist, any of that downstream revenue that's really valuable and important back to the health system. It could be imaging revenue, it could be any of the downstream specialty all the way into like completed procedures, things of that nature. All that's left out because it's not necessarily directly booked through our channel or our platform, but we're just focusing on that upfront. But we know that there's, of course, all that great value back to health systems that will follow.
What about the LabCorp?
So LabCorp, a tremendous partner for Praia and for Providence. This was really a strategic goal that Providence set out to solve as they were looking to reduce some of their operational costs, operational burdens. They've developed a really strong operating partnership with LabCorp to operate a lot of their core facilities. But a core pain point kept surfacing internally, both at LabCorp and for Providence patients, of when a patient is actually ordered a lab, they have a hard time going and actually knowing where to go complete it, right? And when they can actually go complete that appointment. So what we're able to do is bring LabCorp's native appointment booking flow directly into the Praia platform. So we've actually partnered with them, built their APIs, and worked with their tech teams on bringing their APIs into our environment. So as a patient is ordered a lab, you can actually go through and click to schedule that lab in a LabCorp facility directly within the health system property. So going back to where we started of what is that patient experience orchestration capability, patient doesn't actually, they know that they got a lab order and we'll actually send out a push notification tied to that. They don't have to go leave and go into LabCorp's website or anything of that nature. You're still within the health system web portal or mobile app. And then you don't have to create another account. You can actually click to schedule. And then in your mobile or web experience, you also get a QR code that lets you just check in when you go to LabCorp. So that it's completely seamless for the patient, all done through digital, helps the LabCorp team a ton because you can just go into your appointment, scan the QR code, you're checked in. You don't have to go re-authenticate. You don't have to give them another insurance card. You don't have to show them your ID. All that's taken care of through that capability. So it really eases a lot of the burden on the staff from a registration perspective, but also makes it so much easier for patients to go book those appointments. And I think that what we saw was I think it was an 8x increase in patients completing their lab. So that flows into both from a revenue perspective, of course, but it's really important from helping providers manage care, right? Knowing where a patient is with certain blood measures, things of that nature. And also really important from a care gap closure perspective for a lot of those needs as well.
Those great results, and really during the design, we could see the impact it was going to have and the excitement from Providence and LabCorp. And that led to an investment by LabCorp into Praia as well. So they are a shareholder of Praia and have a board observation seat. So great relationship. We're just starting to work in the market with them. They're obviously a strategic partner to half of the health systems in the country. So I'm really excited about that relationship starting and really kicking off in earnest in Q1.
The last fun thing I'll add is, and this really ties close with the Praia intelligence capabilities that we released, but by knowing when to nudge patients, by being able to engage with them through that personalized nudging and prompting, what we've seen is if you send, for example, patients, hey, you have a lab order, that alert, that notification, it's of course branded to the local health system. They're coming into those properties. You're logged in. Once you're coming in through that push notifications, you're already logged in to engage. And then patients are actually completing all kinds of other actions. So it's really exciting to see this kind of network effect of what we're able to drive from a digital services, digital transaction perspective. Patients would come in and say, oh, I do have a specific care need, right? I could have another alert, another reminder that tell me that I'm overdue for my annual wellness exam. I'm overdue for a specific screening alert, things of that nature. So we'll see this great lift, this great uptick in completing all those different tasks. And then also more administrative things at the same time, right? Patients were coming in and paying their bills. Got a lab notification, and then we saw a 52% lift in patients actually paying their bills when they came in through that channel. So it really helps the health system drive a lot of different metrics and strategic goals if you put the right services for patients to interact with through that channel.
Hey y'all, I'm here with Sina Arham, founder of Friday's Health. Sina, what do you think is broken in the traditional approach to metabolic health, and what are you doing to flip the script?
Let's be honest, the moment in metabolic health is being driven by the GLP-1 receptor agonist class of medications, right? We finally have something that is addressing metabolic health, obesity, and type 2 diabetes in an elegant fashion, right? It's efficacious, it's manageable for patients. And so I think we're having our moment in metabolic health in that the old guard of tackling metabolic health and obesity has a lot of stigma attached to it, a lot of shame and blame and guilt.
Thanks, Sina. Visit joinfridays.com for more information and tell them you heard about it from the Healthcare Wrap. It's amazing. Again, those numbers are real. I mean, you said an 8x increase in lab appointments getting done. I mean, that just goes downstream, and that value is pretty substantial. I mean, that's what I'm hearing here. All right, the Praia intelligence side, tell me what is that? What problem is that trying to address? Like who kind of benefits from taking advantage of that?
So we've always used a little AI in the background. I'll say we're being a little more foreground with that now as its acceptance is coming and adoption's happening quickly, and we're kind of moving past pilots into production. So this is just really, we're building it into the platform to add intelligence on offering up the next best action all the way to doing some of the administrative work required to put together outreach campaigns and nudges. So using automation and AI where we can to make the health systems resources more productive as well, but keeping a human in the loop. So we're trying to stay kind of within and under the kind of the governance radar to some extent. They're not directly touching patients and impacting care. That brings a whole nother level of kind of review and piloting into it, but really focused right now on kind of administrative efficiency in the back, as well as serving up options that might have been done manually by the health system.
Well, the other color I'd add is it really benefits, you kind of asked the question, who does it benefit? And this is really where it starts to benefit the patients the most, right? So no longer are you getting generic alerts or generic column ticklers that come in from the health system and you're, well, what do I do with it? Hey, you have a message. And it's like, well, great. What is that message? I'm not sure who it's for. I've got 2 daughters. Sometimes it's for one of those proxies, right? So, and it's hard to figure out who in the world the message is for. So it actually, the real benefit is that we're letting patients know what they need to do and what actions they have to take. It could be a proactive care recommendation. It could be, we know you're going through this journey and this specific, oncology journey or cardiovascular journey. And here's just some tips and tricks and how to eat better, knowing what we know about you, all the way through, hey, you are overdue for these specific screenings. And here's the risk factors. With the longer you wait, the worse that risk can potentially come, right? So the real benefits is it's really going back to the patients, right? For getting them to engage and letting them know what is personalized and specific to their care needs. That's what we really are driving towards at the end of the day. Of course, there's ROI considerations and we want to drive health systems, but really we're focused on making that patient experience better. And whether you call it a patient experience or a consumer experience, I think we've seen just about everyone talk about it differently recently. But our focus is really bringing in both consumers and patients and engaging with them across the spectrum.
Yeah, again, I think we can't overemphasize enough the importance of the infrastructure that has to be there to be able to do what you just said, to have that happening on that personalized level, for it to be proactive, for it to just be so background that it actually makes sense for the patient and they actually take action on it. There's a lot to that, which kind of brings, it always makes me think about if we could use a platform, even like this podcast, to say like, hey, every health system out there, here's what I wish you knew or understood better, right? Because I think that's one of those things. I'm like, yeah, there has to be some investment here, and this doesn't just happen, and it doesn't happen at any level right now on its own. That's why you need the whole concept of orchestration going on to power any of the actions that you're describing. So like what do you each wish every health system out there understood about their own consumer experience? I mean, like what to do about it? I don't know, kind of open-ended here.
And I definitely don't want to make a blanket indictment, but it feels like there's a lack of investment in the consumer experience, which sounds counterintuitive and it's a little self-serving, but the number of point solutions out there is diminishing and systems are reducing the number of vendors they work with. But for all the money spent on building incredible provider brands, it feels like the last mile has really been ceded to EMR vendors and really a generic or a vanilla experience. And again, this is all pretty recent. I was in patient engagement prior to coming to Praia. And it just feels like that's becoming not an afterthought, but a reliance on the EMR, I'll say. Every report or study you read signals that health consumers will change providers over a poor digital experience. I just saw one last week that 65% of patients believe that coordinating and managing healthcare, the 2 areas where a portal or an app should be helping, are still overwhelming and time consuming. And then 50+% of patients believe that their health would be better if they had more support navigating the healthcare system. And really, the heart of the problem is the fact healthcare providers have kind of treated portals and apps as information repositories, but informed patients they want more. They want empathetic, personalized, and well-rounded experiences that they can trust, and they're looking to do more than just basic things. They want insights, as Doug kind of mentioned, with prior intelligence, and there's a lot of tools that can provide some of that, but not just pulling up a lab report, but give me some insights into it. Care management tips, plans, pathways, things like that. And then really financial guidance, which we've got a great use case around our insurance eligibility. So really just get more meaningful interaction. And I always use she's not listening, hopefully, but my Greek mother-in-law is kind of a litmus test as my target audience. So unfortunately, a voracious consumer of healthcare services, but not of technology. But if you asked her, we brought her on the podcast and asked her, she'd say she's thrilled that she can book most of her appointments on her computer. And that to her, that's a big leap forward from playing phone tag or faxing over records from our house or delivering records by hand, right? So she went from that, the dark ages, to I can book, and she's with a $35 billion revenue health system in Chicago. And you still can't book all your services, which is kind of crazy. But for someone coming out of the dark ages, this looks awesome, but they just don't know what they don't know for some of the older consumers of healthcare. So we can do much better. Things are changing, and consumers are going to, in mass and totality, going to demand a better experience. And with the cost and difficulty of new patient acquisition and retention, it just feels like the easy button. Now, I think there are very few chief marketing strategy or digital officers that if you got them under a cone of secrecy or some NDA and they didn't fear reprisal, no one truly believes that the out of box that you get from the EMR vendor is sufficient or provides a differentiated experience. By definition, really, if you're using out of the box vanilla, you don't have an innovative or differentiated experience. So, but as I mentioned, as consumers step up more, they're going to demand more and better. And I think systems understand it, marketing officers understand it. It's tough to get past good enough in some areas.
Justin covered that well. The other color I would add is I've seen, and I saw this internally at Providence, and it's a lot of the reason we actually said, hey, let's take this technology, this asset, and bring it to other health systems is all around, you don't have to build it yourselves. Because I think historically there were a lot of health systems that went down that path, and we used to do tons of on-sites and talking to partnerships with other health systems and say, hey, how are you building this? How are you focused on that? A lot of those kind of died on the vine over the years. Too expensive, didn't get the results that you wanted, you name it, any number of challenges, right? This was the uniqueness of Providence, is this pedigree of building great technology and spitting them out to the market. And that's really what we focused on is you don't have to go build it yourself, but we're a development toolkit, we're a development partner to health systems that you can get all of that infrastructure, all of the plumbing, the electrical, kind of the messy stuff taken care of. And then you still get to own that last mile delivery and experience. We're not owning, dictating what that looks like or anything, right? But that's really the secret of Praia, is that you still get a lot of that messy work done for you, and then you still get to own that last mile experience and brand it to meet your specific design constraints and brand considerations, all that fun stuff that really is important to health systems from a brand and marketing perspective.
Well, I appreciate the point of view on all of this, because again, this is all about just what it takes to make this happen. And we just have to keep beating that drum. We have time for an abbreviated rapid fire round, if that's okay. It's just a couple. I had more, but I'm we'll just limit this to a couple. Just an either or. I'll just shoot them in rapid fire. Doug first, then Justin. Just your preference. No context or anything on these. We're just going to do it. This is how we wrap today. Okay, rapid fire. Ping pong or pickleball?
Ping pong, you might remember, Jared. But...
Oh, don't I? Don't I remember? Chicago or Lake Tahoe?
I'll go Tahoe. The water's a lot cleaner.
I have to say Chicago or face some repercussions.
Yeah, I'm pretty sure you have some contracts in place there. Okay, Goonies or Stripes?
I'll go Goonies.
Go Stripes. Doug probably doesn't know what Stripes is.
I was going to say, I didn't want to say that.
I refer to memes in your Slack channel. I will just say that. Okay, well, appreciate all of that. And Doug and Justin, again, want to wish you the best of luck in everything you're doing. Appreciate everything you're working on to make healthcare more consumer-centered. That's what this is all about. Thanks for sharing with us a little bit more about what's going on at Praia, and looking forward to keeping in touch. We'd love to have you back. We're going to finish the rapid fire round for one, but keep going. I'd love to just get your opinion, especially on the market and things that are happening right now. It's a whole other track of things that I have questions about that we'd love to have you back on soon.
Wonderful. Yeah. Thank you, Jared.
Yeah, love to. Keep up the great work.